Hello, everyone, and welcome to Season 2, Episode 2 of DogLab. This is Brian Burton. Today we have Sarah Fraser back to talk about the common pitfalls and things overlooked during the different phases of your dog's life. We cover puppyhood, adolescence, which is the quote-unquote turbulent teenage years, adulthood, and the golden senior years. If you have a young dog, you'll want to listen to the entire episode. If you have an older dog, you can see the timestamps for the various stages in the episode notes, but it certainly is helpful to listen to these earlier stages and reflect on you and your dog's time during these years. If you would like to learn more about life stages and how other areas of your dog's nature can shape how you best nurture them, you can register for our Nature Driven Nurture course at onlineschool.instinctdogtraining.com. That again is onlineschool.instinctdogtraining.com. And this includes a private Facebook group and bi-weekly drop-in Q&As with myself and Sarah Fraser, and occasionally we have the owners of the other Instinct locations or trainers across the company join as well. Like me, Sarah is co-founder and co-CEO of Instinct Dog Training and has a master's degree in animal behavior from Hunter College at the City University of New York. Here once again is Sarah Fraser. All right, Sarah, welcome back to the podcast.
Hello, nice to be here. On
Awesome.
this rainy, gloomy day, if people who are actually watching the video can see sort of outside the windows, but
yeah, it is pretty gloomy today. So we are talking about canine life stages and behavior, and I think the reason that we wanted to do this episode today is really just how much life stage can actually impact our dog's behavior, how we understand our dog's behavior, how we choose to work through a program, and what we're going to work on, and what are realistic goals. And I think the good thing here is that while there are things that are being overlooked frequently, there seems to be sort of like repeat offenders, I think. So, and sort of things that are not super complicated after but some of these things aren't always super intuitive. So the goal here is to walk through puppyhood, adolescence, adulthood, and the senior years, and walk through that. So is there anything you wanted to add before we sort of jump into puppyhood?
I think I would just say I'm definitely looking forward to this conversation. And I think, yes, just sort of teeing it up as examining life stage as one of the, especially depending on the life stage, one of the pretty important elements of a dog's individual nature. And then, yes, as you mentioned, sort of getting into like, what are the things that we seem to maybe get wrong most often in each of these stages as it relates to how we nurture our dogs and ways we can, approach it in a more optimal way based on those life stage factors. So yeah, certainly looking forward to the conversation. Yeah. And I think the other thing I would just like to say is it is the hope that whether your dog is a puppy or is an adolescent or is an adult or a senior, it's always nice to sort of have the ability to compare and contrast. So I think there will be value in hearing about some of those developmental realities of the other stages that your dog's not currently in, either to help you reflect back and think more clearly about behaviors you may have seen in the past, or to sort of prep you for what they may be moving into in the future.
Yeah, perfect. So I guess we'll just go through in chronological order. So I think we'll start with puppyhood first, and it's definitely a good one to start with because this is definitely a turbulent time. It's really fun. Puppies are super cute, and puppies are also a ton of work, and are developing quickly, through this stage. So I guess, where do we want to start with puppies and what we want people to know?
Sure. Well, it might be helpful at first, if we sort of think about what are things that people tend to prioritize during puppyhood, and then potentially before we get into ways we do that, ways we potentially maybe execute on that poorly or not optimally in ways we can adjust. First, just looking at like what are some critical things about this period of development, or what are some notable things about this period of development that make it particularly important for us to provide nurturing in certain ways and to potentially sort of reshuffle or reprioritize certain goals that we might have, if that sounds reasonable. And I think the other piece, just for the purposes of defining who falls into what range, when we talk about puppyhood, you can almost sort of split it up into two stages, but certainly that period 14 weeks and earlier, those super young puppies, where often if a puppy's coming home between like kind of 8 and 14 weeks of age, there's a particularly critical or sensitive period of development that's often happening within that. But then sort of continuing through, if we talk about puppyhood generally, we're generally talking about those dogs who are younger than 6 months of age. So keeping that in mind when we talk about puppies.
Yeah. Yeah, absolutely. And so I guess, so I guess maybe like the first place to start is around socialization, maybe perhaps,
Sure.
because I think that's one thing that thankfully, most puppy owners have heard of, and want to make a priority. Though there does seem to be some confusion, I think, around what socialization actually is versus just sort of exposing puppies. So, what are the key things that people should keep in mind when laying out a socialization plan for their puppy?
Sure. Well, and I think so. The first question is the first, I think, important takeaway is yes, it is critically important, and certainly versus the, I think for a long time we sort of had to navigate conflicting motivators between sort of protecting a puppy who wasn't yet fully vaccinated and exposing them to the world that they're going to live in during this really, really critical period of development. And I think more and more now, as veterinarians and the public as a whole have come to sort of understand the importance of this period of time in a puppy's life, and the importance of what we'll speak on in a second, how their brain is developing and how socialization impacts that brain development. I think more and more it's less a question of whether or not to socialize a puppy and more a question of how to do it well. To your point. So if we're talking about how to do it well, I think, things for us to really keep in mind that are going to influence how we set up positive socialization are, number one, just remembering that like puppies' brains are absolutely still very much developing at this age. Their brain is primed to form all of these new neural connections in response to different like sensory and social experiences. And the types of experiences that they have is going to influence, how robust that network of neurological connections is. And that's going to influence a puppy's future ability to cope with novelty, to regulate their emotions, to learn effectively. So really, really important that we're getting those exposures to happen, versus have them being more isolated at this stage of life. But I think the other flip side of that is, there's this whole thing about kind of the power of first impressions and the realities of classical conditioning, and the fact that puppies are really impressionable and pretty sensitive to new experiences at this stage. They're experiencing a whole bunch of firsts, and they're making a whole bunch of first impressions. And so they're really sensitive to new experiences, both positive and negative. So it's really important that we keep that in mind, that we have these super impressionable developing brains that are making conclusions or, gathering information about how the world works and what's safe and what's not and all that kind of stuff. So that's going to influence how we set up what socialization experiences look like, which I think starts to lead into your next point about the difference between exposure versus positive, appropriate socialization. That was a bit
Hmm.
of a ramble, but hopefully it sort of sets the stage in terms of like what we're thinking about that's happening on the development side that's going to directly influence how we carry out socialization. And so I don't know if you want to speak a little bit maybe about like what that then means in terms of what socialization looks like or what owners should sort of be keeping in mind when socializing their puppies.
Yeah. And yeah, so I guess yeah, I mean that's a great segue into that, and I think there's like multiple things that sort of get overlooked here, and like so one is again talking about because there is positive and there is negative experiences. I think one of the areas where that we have to be careful of is that we're not like artificially setting the puppy up for negative experiences. And so that can mean both in terms of like the intensity of stimuli. So like one of the ones that I hear people talk about is like, oh, like so in New York City there's like fire stations, right? And so maybe if you have a puppy and you have a fire station nearby and there's no fire trucks going out and there isn't a whole big rush of people getting dressed and running out the door, that can be a good thing. But of course, if like the sirens are blaring and there's lots of scary movement and it's like extremely hectic, that could actually completely backfire on us. And that's sort of like a like an extreme example, but I do think that that's also important too. So it's like even when we want to expose our puppy to other people,
Mm-hmm.
taking them to a July 4th gathering with 30 people having adult beverages for 6.5 hours is probably not going to be a good thing, and it's probably going to overwhelm the puppy. Um, and so I think it's both like the intensity of the exposure, but then also I feel like the timing of the exposures, and like really like in my opinion, anyways, and is less is more a lot of times. Like you still need to do it, you need to find these experiences, but it's sort of like you have the experience, you interact for the 2, 3, 5, 10, or 15 minutes, and after that point, I think you're good. Like I don't know, like it's sort of like diminishing returns. I think in terms of that exposure,
Well,
and,
yeah.
and
Oh,
yeah,
sorry. Go ahead.
oh yeah, and I was just gonna say like that also I think even goes for when we have puppies that again, and this is probably a good place to talk about too, just sort of the sort of the conflict sometimes with the primary care veterinarian in terms of like saying you have to isolate your puppy until they have all of their shots, which is a lot of time at 16 weeks, which is when that critical window that you spoke about is either closing or starting to close. And again, it's not really like open and shut close, but dogs just become less receptive to to novel stimuli. um yeah, and so with that conflict of interest, typically I think one thing, if people are getting that advice from their veterinarian and they're looking at sort of different sources, because again you're going to find like a million different things online saying do this and don't do this. One nice thing to share with your veterinarian is definitely the American Veterinary Society of Animal Behaviors position statement on puppy socialization, which generally recommends you can do like responsible socialization after their first round of shots, because the puppies typically get three shots spaced 2 to 3 weeks apart. That allows you to start socializing after the first shot plus 7 days, so that sort of kicks in, and then you're keeping them on top of those boosters as you go. Because they say you can take them to puppy class and probably do like short little walks where you wipe their paws. Like you generally want to keep them away from like areas where dogs are pooping and those types of things. So you want to avoid like dog parks, and if for those of you in the city where 150 dogs a day do their business, probably good to avoid those sections. But even if you're doing that and taking your puppy out and giving them that little bit of exposure, I don't even think it has to be done every day. Especially in that like 8 to 11 week period when they're pretty young. So like every other day, and then also starting off by times where you're picking quieter times to do this, or quieter streets to start on. So I think both like in terms of like the intensity, starting with stuff that's definitely lighter and something that that your puppy can actually be resilient to, and hopefully they might be a little bit nervous, but they shouldn't have anything that hopefully doesn't cause like a big startle response. And also like resisting the urge where it's not like running them through a gauntlet of like like every day I'm going to do all kinds of novel stimuli every day. Like they do need some time to rest and take a break between between these things, I feel like, to process. So those were the couple of things I just wanted to add there.
Yep. No, agreed. I think that's sort of that quantity over quality, as long as you're meeting some minimum level quantity, is really valuable. And I think that this whole thing sort of I think perhaps to wrap up on the socialization piece before we move on to one of the other pieces of the puppyhood development stage where we sometimes go astray, is I think it's really important to define our goals for socialization for puppies. And if we kind of break it down, it's if we think about what our goals are, why are we socializing puppies? One is to help them develop a view of the world as a place that is safe and stable and full of opportunities. And so setting up our exposures accordingly. Are we ensuring that they feel safe when they're being exposed to new things? Are we ensuring that, those experiences are not overwhelming, as you said, and are largely positive and do present actually a lot of opportunities for good things to happen? So setting up exposures that establish the world as safe, stable, and full of opportunity. And then I think the other piece of this is the reality, to your point, is there's no way for us to expose our puppies to everything they will ever encounter at some point in the future, right? Like so a lot of this is about also helping puppies feel confident and comfortable and curious in the face of novel stimuli, right? And I
Mm-hmm.
feel like that's as big and as important a piece of socialization as explicitly getting you comfortable with dogs or getting you comfortable with people or getting you comfortable with balloons. Like there are some things on the list that we know they're going to encounter over and over again that we absolutely do want to take the time to say, hey, people in the background, safe, stable, mostly full of opportunity. Dogs, same thing, because I'm going to control who you're exposed to leave you with that impression. But also that just general get you comfortable and confident in the face of novelty. That builds a resilient puppy. It builds a puppy who knows how to cope with all the various things they're going to encounter at different stages of life that they've never encountered before. And so I think if we sort of think about those as our goals, that can help us make the right choices with everything you already said as well, Brian, in terms of like being mindful of not just overwhelming the puppy, because that's not creating a view of things as safe, stable, and full of opportunity either.
Mm-hmm.
I think if we keep those things in mind, that's probably really helpful in guiding what it means or what our goals actually are in terms of socializing a puppy.
Yeah, absolutely. Good.
Um, yeah.
Cool.
And so then one of the next ones, I don't know if you wanted to talk about it or I can raise it as a starting point. One of the ones that I see happen often when we're navigating puppyhood.
Yeah, go ahead.
Cool. I think one of the other ones is this balancing of goals that we have related to sort of house training and manners and skill development, coupled with ensuring that we're meeting the needs that our puppy has at this stage of their life as it relates to sleep and as it relates to social contact and taking into account the fact that they have limited emotional regulation and limited amounts of impulse control is, I think, sometimes, to say this more succinctly, we can end up doing too much or too little confinement. We can end up putting too much pressure on a puppy to get where we want them to be house training wise, when in reality, if we took things a little slower and did it over a span of a few weeks longer, it would be a million times easier for everyone. So I think, yeah, the balancing the need, humans and dogs and puppies, balancing the needs for sleep and the needs to not spend, a huge amount of time confined with the desire for owners to get house training in a really good spot really quickly, I think is a point of conflict for a lot of folks.
Mm-hmm.
and one that like this one falls into the like there's absolutely training and putting things on a good schedule and all of that involved, but a lot of this is development too. Like these are
Hmm.
babies, and sometimes we think we just need to kind of take a breath and relax and trust that yes, your puppy's going to have accidents. Yes, you need to sleep. Yes, it's okay if this takes a few weeks or a month or 2 months longer than you wanted it to,
Hmm.
because they're a puppy and they're learning. You
Yeah. Yeah. And because I do think there's a lot of information out there that puts a lot of pressure on getting the house training right from day one, the second your puppy steps into the house. And, I think, and honestly, like I used to feel that way too back in my earlier training days, because there's just sort of the wisdom that was passed around and everything. But I think after, us seeing, you know, thousands of puppies probably at this point, and actually doing puppy raising with hundreds of puppies and house training hundreds of puppies, I think the reality is like there's time. Like it's like there is time. Like you said, there's going to be accidents, and if you set up the guardrails correctly, and you start like they're learning how to go outside. Like so there's a couple different situations, but like most people I think want their dogs to to go outside. So like if your puppy is going outside once, twice a day or three times a day, but they're still using a wee wee pad inside. So whether you have like your little penned in area with the little bathroom on one side and their little house on the other side, and some people make the little house with another crate inside there with the door open so they can kind of go out and do their business. Like just because your puppy uses a wee wee pad for a few weeks or a couple of months, it doesn't mean they're going to be stuck on those wee wee pads forever. And I think that that's like, and to your point, being able to use something like that, then it makes it a lot easier for the overnight situation, because they can just go to the bathroom at 5:30 a.m. and go back to sleep, and they're going to get more sleep, and they're not going to be up and aroused, and the parents are going to get more sleep, which is going to lead to probably more patience and more you know,
know.
um, empathy and understanding throughout the day for their puppy, because being tired sucks and having a puppy is hard.
Mhm.
And so I think you're right. And so I think just normalizing that accidents are normal. Um, and but I think like again, to kind of to make sure like as people move through it, like if you have the setup correctly, especially if you're working with a trainer, kind of them setting you up through the stages, and how we get to the point where maybe you start closing the crate door overnight, or when you take the wee wee pad away, but your dog will not be doomed to use wee wee pads forever. I think the other thing is I think there's also a lot of pressure just on this topic on people to make their dogs go outside. And so if you have like a little dog and you don't mind having wee wee pads and cleaning it up or making a little area, like that's okay too. And again, younger Brian would definitely be like, oh, dogs have to go outside. And if I was living in a high rise apartment with a small dog, they would be wee wee pad trained at this point, because it is like convenient and it's totally okay.
And I
Um,
think to clarify your point for people as well, it's not a suggestion that that's a replacement for giving your dog the appropriate level of exercise, enrichment, and exposure outside to like
no,
do dog things. This is specifically to using the bathroom in certain locations and where
yeah,
that happens, and that being
yes,
totally an owner preference and choice. And there are 100% appropriate ways to do that, or a whole bunch of different ways to do that appropriately, whether
yeah,
it's inside only or outside, or a combination of both, but not as a replacement obviously for like, oh, your dog never has to go outside at all. I know, just to
correct.
clarify that that's not what you're
No,
suggesting in any way, shape, or
but
form.
But if you are in a high rise or somewhere and you have like a 3 day snowstorm, or it's like rainy all week and you have to do that 10 p.m. walk and you don't want to, like that can be like a really handy, and it's totally okay. And lots of dogs can go outside fine, and they have that option inside. So, but again, like I do think we rush that, and to your point, like it interrupts with sleep. It puts a lot of pressure on the dog. I think sometimes it can even create issues with confinement and those types of things, because we're putting way too much pressure on them. So,
And
you
can
know,
sometimes lead to the overuse of confinement as well. I think most
yes.
owners are pretty careful and conscious of not wanting to do that, but if they're feeling that pressure of like, oh, absolutely, they can't have an accident, and if they're in their crate, I know they won't go to the bathroom. That can lead to the puppy spending more time in there than they should.
Yes, absolutely.
Yeah.
Yeah. And then the other big one too is like puppy mouthing, right? So when people come for puppy stuff, it's definitely house training is usually number one, and mouthing is either number two or number one depending on the puppy, because there are some sharky puppies out there.
Hmm.
Uh, but just sort of like in your experience, I mean, in terms of mouthiness, because it is something the vast majority of puppy owners deal with,
Hmm.
and something that they want to quote unquote fix, but you know how do you tackle this now versus maybe how you did earlier on?
Sure. Yeah, and I like that piece of it too. Is there's always a range, and there's going to be puppies who fall outside the quote unquote normal range in terms of intensity and frequency of nipping and mouthing. But I think when we talk about that sort of mouthy, like oral explorer behavior, that is as fundamental to the development of a puppy as it is to that like stage that little kids go through with wanting to pick everything up and put it in their mouths.
Hmm.
Like we would never suggest that there was a path to stopping a young child from doing that. We just manage the environment accordingly. And so I just want to say that it's as fundamental a part of their development as it is as that other oral exploring is with humans. So I think keeping that in mind and knowing that also puppy brains, as previously mentioned, are like pretty limited when it comes to impulse control and sort of emotional regulation, is that looking at like the various drivers for when quote unquote inappropriate mouthing is likely to occur, and also providing lots of, we'll call them like legal or appropriate outlets for that mouthy, nippy, gnawing oral exploration to take place. So for the first one, I think it's always making sure there's a variety of like safe, um, objects, chews, bones, whatnot, for puppies to have of varying textures and hardnesses and stuff at an appropriate level that's safe for the puppy. And then managing the environment to make sure that if there are things that you don't want them to chew or gnaw on or mouth at, like we manage that.
Hmm.
We manage that with gates or with pens or with picking things up and putting them away. Like this is a stage of life where you manage that. And then with mouthing specific to the people, again, a lot of that is we're putting almost zero responsibility on the puppy at this stage of life, right? Like they're a puppy, they're doing puppy things. And if they're mouthing, some of the things that we look at are like, do they need a nap? Are they overtired? And so they are, again, more impulsive or losing emotional regulation, and they're just bitey at everything. Are they feeling frustrated? And so what can we do to adjust the situation to make them feel less frustrated? Are we doing things with our hands or our bodies or our voice that invite nipping and mouthing, like using lots of sort of fast, exciting movements and petting, or making high pitched noises, or, you know, whatever it might be. But I think a lot of this is just, and we'll include maybe in the resources, just some of the, for the podcast episode, some of the resources we have on navigating through puppy mouthing. But I think the biggest thing is, yes, for the vast majority of puppies, it's super normal. It's something that we manage and we adjust the environment and our own behavior to navigate through this stage to make sure they are feeling comfortable and not developing unwanted sort of long-term bad habits, but mostly to just like get us through the stage of development where that sort of naturally subsides on its own.
Yeah. Yeah, no, I agree. And like, our nephew was here last week, and we have some like an antique typewriter and this old antique scale type thing that was right next to a window, and it's like, you know, we just picked them up and moved them away, and everyone does that with kids, and like, but for some reason there seems to be resistance to do it with a 10-week-old puppy, and it's in some ways a 10-week-old puppy is even younger and way less likely to be able to understand what they can and can't get into. So that environment setup's right. And I think like, so really like when people talk about puppy proofing, I think people think about, oh, I'm going to pick up the stuff that we don't want them to chew. And that's true. But then it's also making sure like, hey, what are all of the different things that they can chew on? And maybe having like 8, 9, 12, 15 different toys of different textures that can be out and around, and where they can explore and do that. And Yeah, and then in terms of like the chompy behavior with people, like I do feel like the vast majority of times it is something that I feel like it's an area where when people try to quote unquote correct that mouthing behavior or discourage that mouthing behavior, it just sort of creates more of a mess. Um, because the vast majority of puppies are going to outgrow it anyways, and if they are being too mouthy, then that's where it's like, hey, I think 7 times out of 10 it's because they're tired. Like puppies should be sleeping, you know 16, 17, 18 hours a day anyways. um,
Mhm.
and they are tired, so that's when. And also too, the other thing I'll just add in is also, if you have one of the more sharky type puppies, definitely having them when you're home with them and you're supervising them, just have them drag a lightweight leash around, because if they do start to get really mouthy, it's really easy to kind of like pick up the leash and lead them to their pen area, wherever they're at, where they can get comfy and sort of sleep it off and come out fresh. But to kind of just not make it a big deal, and for the most part, as puppies mature and hit 5, 6 months of age, like that's 7 months of age, like those that behavior is largely going to go away. And I would say, if you end up with holes in you, and those if there's a lot of bleeding going on, then that's probably outside the realm of normal, even though puppies have sharp teeth, so that's when you'd want to reach out to someone. Um, but yeah, again, this is something we just need to normalize. It's just normal development, and we just manage our way through it for the most part.
Yeah, exactly. Manage our way through, put the responsibility on smart environmental setup and adjusting probably some handling and interactions and wellness routine pieces
Hmm.
versus putting the responsibility on a puppy doing a normal puppy development thing to stop biting. And
Yeah.
again, that's not like to indict any individual owners. That's just something all of us have like we've been culturally conditioned to like label a lot of behaviors just sort of blanket as like bad or need to be trained through or need to be fixed versus like what's normal for this stage in development and how do we get through it, much like we do with kids.
Yeah.
Yeah.
Absolutely.
And then I think the last one and you may have others as well, that I just wanted to give a nod to for puppyhood, that I think as dog owners we can sometimes take for granted or overlook, is that based on this stage of life and this stage of development, most puppies are super motivated to maintain pretty close proximity to their social group and be pretty responsive to invitations to come when called. So we always just kind of joke that like you're the most interesting you're ever going to be to your dog when they're a puppy, like right now.
Hmm.
And so you can say like, oh, my puppy has amazing recall and they come when called every time, or I just make a little kissy noise and up they come. And that's awesome. Like we should not assume that that will continue into adolescence and adulthood and senior years by just continuing doing what we're doing. I think it's like it's a wonderful opportunity during that stage of life where the motivation is there to reward the heck out of it. Like do
Yes.
not take it for granted. And when I say reward, I mean like reward with good stuff. Like
Yes.
like really yummy treats, a really like a favorite toy in a little play session, like something that a puppy really loves, and still be judicious about how often you're calling them.
Hmm.
Like don't wear it out, really call them when you need to and reward them for it, because that will decline if you just sort of, for the vast majority of dogs, if you just sort of continue to call them and take it for granted that they're coming, because that's
Yeah.
really a life stage thing. So I think I would just throw that in there as something to be mindful of for that stage of life.
Yeah. Cool. Well, we spent a half an hour on puppies, so I'll definitely I'll have to put some timestamps in this episode because this might be a little long. But I definitely will put the resources on, the reasons why puppies are mouthy. I think there's a blog post on that. That's really helpful, I think. And then we also have one on just like house training as well. So I can share both of those
Perfect.
in the episode notes. So should we move on to the scary adolescent phase?
Yeah, and this one may be a little shorter because I think we also have some other blog, like really fantastic adolescent specific blogs that we can point people to.
And
But
a
I think
podcast episode that I'll put a
podcast
link to as
episodes,
well with
yeah.
Dr. Naomi Harvey that we did last year as well.
Yes, exactly. That were like just that was a fantastic episode. So for anyone who hasn't listened to it, we'll certainly put that in the notes for you to go check out. But still will be good to, I think, maybe go through again this sort of focusing in on what are some of the things we get wrong is a terrible way to say it, but like where are the common missteps in
Yeah.
nurturing adolescence?
Yeah.
Um,
Yeah,
so
absolutely.
where would you like to start?
Well, I think the first thing is, and again, for people listening, we're not experts on adolescent brains or anything like that. We although we both have a graduate degree in animal behavior, so we do understand behavior and some of the high level stuff. But I guess there may be like, what are some of the changes that are going on? And people, if they want more detail, they can listen to the Dr. Naomi Harvey podcast. But
Yeah.
if we gave like a quick little synopsis on like what's happening in the adolescent brain.
Sure. So I think the thing that's really cool is there's been some research done to actually, and this is talked about in that episode with Dr. Harvey, that dogs really do seem to go through a pretty similar change in development and accompanying brain changes that go along with it that maps pretty similarly onto human adolescence. So they really do kind of go through like teenagehood. And what that means in terms of some of the brain changes that happen, again, at a really high level, is that like the parts of the brain that influence cognition and social behavior and decision making are still not fully developed. And at this stage of life, the brain also shows increased activity in the parts of the brain that influence arousal. So, like how easily sort of excited they become, and in reward seeking behavior, which maps onto what often look like increased levels of impulsivity and a whole lot of increased risk taking behavior. Um, so, as normal parts of adolescence, and again, a pretty huge variation by individual, but those are some of the things that are like developmentally normal, quote
Mm-hmm.
unquote, to see, or expected to see, I guess is a better way to put it. Some of the other things that come along with adolescence as a dog's moving out of this sort of puppy juvenile stage into this transition period into adulthood is we will often see sort of changes in conflict resolution style, sometimes some again going along with kind of impulsivity and risk taking, some like testing of social boundaries, and some changes in social tolerance sometimes for other dogs. This is also a stage of life, and this is less this is more like an observational thing versus being rooted in, I think, in any sort of peer-reviewed research. But this is often the time where we'll also see emergence of some of those more like breed typical behaviors that we would expect to see in certain dogs. So yeah, I don't know if that does an okay job
Yeah.
of answering that question.
Yeah, no, I think that's great. And I think calling them teenage dogs is totally fair.
Yeah.
And because people will also come in this stage too, and their dogs, they'll use words like bratty or
Mm-hmm.
selective hearing and those types of things. And it's also, again, it's remembering that they are going through a phase. It can be a very frustrating phase though, especially if you haven't gone through it before, because it's, if you don't have that frame of reference on that this is normal, or
Yeah.
is this going to go away, sometimes it's a little harder to be patient.
Mm-hmm.
But yeah, it's definitely fair to assume it's the teenage phase, and so yeah, you are going to see that behavior. So I guess in terms of common mistakes and missteps with adolescents that people make, what's sort of on the top of your list?
So I have a couple. Maybe we can talk about the one first. I think this is a stage where it's really tempting is not the best word. Um, I feel like the changes in behavior that folks sometimes see can actually feel kind of scary if you're not expecting them,
Hmm.
and can lead some folks down a path. And they're super frustrating, truthfully, especially for some dogs, like barking, big feelings, like not listening as well because there's this increased desire for independence. Like, I think some of those changes can sometimes lead people down a path to feel like, oh, shoot, like maybe I need to step it up and really lean into some like more aversive or like punishment based techniques to like get control over my dog because he's, you know, running wild, or she's running wild. And so I think sometimes there can be a feeling by some owners of almost being like blindsided and feeling pressured to like quickly get control through some more like punitive or harsher
Mm-hmm.
training techniques. And I totally get that, especially when some of the behaviors come off as, like, for lack of a better word, as you said, like bratty,
Mm-hmm.
you know, or willful, when it's
Yeah.
really just like, hey, my brain's rewiring itself and I'm really impulsive and I have a ton of big feelings right now. Um, so I totally get where it comes from, but I do think that's like the reality is that's also a really impressionable time in their life. And they're still sort of navigating through like, is the world still safe and stable? And is my person a safe,
Mm-hmm.
stable resource, you know, and a place where I can go to if I'm not sure what to do? Um, and so rather than going that route, it really is sometimes just taking a step back and saying, how do I help them manage those big feelings? What additional, maybe like environmental management do I have to do through this stage where like maybe my puppy had an amazing recall, but we have to sort of backtrack and spend some time on a long line for a few months so
Mm-hmm.
that they don't, you know, get too carried away with their independence and like wander off and not come back. You know, so I think that's one that like really leaning into your role as a safe, predictable, helpful human. This is some of the times where I think it's hardest to do it, but it's most important.
Yeah.
Um, is that's what I would say is one that like, and I empathize with, but that people can sometimes fall into during this adolescent stage. It's also the stage where I believe the vast majority of dogs are relinquished to shelters
Yeah.
because it's a really challenging time.
Yeah.
Can be.
Yes.
Not all dogs, just like not all teenagers. Like some you'll see
Yes.
really minor changes, but for a lot of dogs, yeah, there's a lot of big feelings and a lot of like behavior changes that are concerning for people that they're not sure what to do with.
Yeah. Yeah, absolutely. And the thing is, during this adolescent phase too, like they can be quite big, especially certain breeds. And
Mhm.
so I think it's also easy for people to think, oh, they're like an adult dog. It's like they kind of have an adult body, but like they're
Yes.
definitely not an adult brain yet. So I know that confuses things or makes things even more difficult if you have a German short hair pointer that's struggling with some impulse control and those types of things. So
Or like a
um,
guardian breed that's sort of feeling out like how big am I and how scary can I be and how good can I be at sort of controlling things in my environment that I'm not sure about. Like, you know, those can be concerning behaviors to see.
yeah, no, they can be. On the flip side of that is, I do think if you start to see, because again, if you have a dog who's either had a traumatic background or they have a genetic background or whatever it is that might start to elicit some of these aggressive behaviors, they tend to start to come out during this adolescent phase. And so again, if you're seeing like aggression, I think the one thing I would just point out that is aggression is different than being obnoxious. Right, like, so I think, like, if they're going through an obnoxious phase, they're like, again, as long as you have some guardrails and you're working on stuff, you're going to get through that phase. If you are seeing aggression though, they tend not to grow out of that behavior, and if you're starting to see that behavior, then that's when you definitely want to reach out to a professional. So I think just making sure that, because sometimes I feel like um, sometimes people don't jump on that quick enough because
Mhm.
again, they are maturing and those behaviors can get more stable over time. So just making sure, if you are seeing things that are actually concerning,
Mhm.
from that standpoint, or also if you're seeing like some fear or anxiety type behavior, again, that's probably not going to get better either on its own. So, and it's usually something you might want to get some help with, and some guidance. So, and even with us, I think there's a large percentage of dogs that come to us that are in that adolescent phase.
Yeah, absolutely. And that actually sort of leads into, I think, the next uh, point, which is this can be a tricky line to walk sometimes. I think I absolutely agree with you. If we're seeing like snarly, bitey, snappy, lungy behavior, certainly go get some help with that, and don't just say like, oh, they'll grow out of it. Especially, oh, they'll grow out of it, so I'm just going to continue to do exactly what I'm doing and they'll grow out of
Right.
it. I think that's the big, like, that's not a great path forward, and that will
Yeah.
likely lead to not great places. But I think what that leads us into is versus, say, someone like an adult dog who's been displaying these behaviors for a while and they're 5 years old and they come in and say, like, I have issues with, men in hats who encounter me or whatever it might be, or like I'm spicy with dogs that I see on the on the sidewalk. Whereas with an adult dog, after looking at all their baseline needs and some of the relationship dynamics and all that kind of stuff, if behavior therapy is part of a program for them, like it likely will be, we're more likely with an adult dog, I am anyway, to jump into, let's, with all those other pieces in place, like, let's do some counter conditioning work, right? Like, let's help them feel differently about this situation, in addition to all the other elements of a behavior change program. With an adolescent, if that's a behavior that I feel like has some life stage specific elements, hey, you're feeling stuff out, you're having big emotions, like, I'd be more likely to lean heavier on, how do we actually just scale back exposure
Right.
versus doing, let's make you, because counter conditioning at that point with their brain development isn't necessarily what they need. It really
Mm-hmm.
can be a matter of like, let's make your world a little smaller and a little less stressful, and let's gradually make it bigger again over the next 6 months as you move out of this tumultuous developmental stage. And
Mm-hmm.
sometimes that can be way more effective than trying to like counter condition those responses. That might be a little bit too technical for this conversation, but I do think it's something to keep in mind, is that like sometimes I think one of the missteps, I guess, to like simplify this a little bit for this conversation is the failure to or hesitancy to scale back and adjust the environment and adapt to some of those different social needs or different levels of sort of stress management to let healthy brain and body development take place. Right. So, like, if you're running into issues and we're having issues at the dog park, really just saying, like, you know what, we're going to take a break from play for 4 or 5 weeks. Then I'm going to do maybe some one-on-one play dates. They might graduate back into the dog park as an adult.
Mm-hmm.
They might, or they might not. But your best chance of them getting to a place where they enjoy being with dogs again is to like take a breath, scale back, and potentially just make their world like a little bit easier and manage exposure for a little bit during that stage. And I guess that's a valid thing to do as an adult as well. But I think that's one of those things that like they can actually come out through the other side of in a totally different place after adolescence if we do that well. So I think that's just sort of something to keep in mind, is versus saying, oh, I need to counter condition them to other dogs. It might be just like, you know what, they need a break and they need some easy wins and they need a smaller world for a little while. And
Mm-hmm.
then you might not have to do any counter conditioning once they get through this tumultuous development stage. Or you might, but that's the difference, I feel like, for that life stage that I sort of sometimes come at it from.
Yeah. Absolutely. And I would say, like, just the last thing, just to add, I think the other thing that sometimes we take a look at too is the relationship between the dog and the owner in that phase, because again, like, even though, even if you're not using, and you shouldn't be using like punitive techniques, there still needs to be some boundaries and things that, and communication about, what's, again, because they are a little bit older, about like, hey, I need you to stop doing this right now. And how do you communicate that? And have we taught them all the right things to do? Is it easy for us to get their attention? Do they like listening to us? And kind of to your point when talking about the puppies, when that's as cool as you're going to get, that adolescent phase comes around quickly. And if you do the work in that puppy phase, it does make the adolescent phase, I think, easier for a lot of people and a lot of dogs, where if you have that dialogue open. And I truly believe, honestly, like, again, like recall and teaching settling skills and all of those things are like those mechanical skills are really nice to have. But a lot of like that training that you're doing, if you're taking a quote unquote obedience class or a training class or lessons or whatever you're doing, is you are learning like a communication style, like, or a communication method between you and another species. And that is also critical during the adolescent phase, because sometimes if they're just kind of out there on their own and they don't really have that guidance,
Yeah.
that can make things more challenging. And so sometimes I notice that jump out at me a little bit more. And it's not that anyone's trying to purposely set up a bad relationship or they're doing anything bad, but if the communication is sort of struggling and being able to communicate that, yeah, I'm happy with this and I'd rather you not do this, then yeah, that provides more challenges. So if you have an adolescent coming, it's definitely a good time to, again, to work on those things. But
Yeah.
really, from my perspective, it's like it really is about you're learning how to communicate. So even if it's taking longer to teach the skills and it might be going slowly, the fact that you're working on stuff consistently will go a long way during this phase.
Yes, absolutely. I think that's a great thing to bring up. And yes, that sort of safe, predictable, helpful leadership mentality is super important in ensuring that you, in your dog's eyes, especially in your teenage dog's eyes, become you ensures you help stay sort of like a facilitator and a source of comfort versus like an annoying obstacle in their way of
Right.
what they wanted to, because I mean that happens during adolescence. So like, I love
Yeah.
those points that you made. Yeah.
Yeah. And I guess for people listening who've never heard about these stages before, I probably should have talked about this at the beginning, but it's kind of like that 6 months to
18-ish months, 2 years, sort of.
2 years, and sometimes between 2 and 3 years, I think, depending on some of the dogs. I feel like some dogs stay in that a little longer, but the typical phase, yeah, that's 6 months to a year and a half, up
Yeah.
to 2 years.
Yeah.
Yeah. Yeah. Cool. All right. Well, that was good. We
Hmm.
only spent 20 minutes on adolescence, so we're
Well
doing
done
better.
us.
All right. So then, all right. So we got through the sleep deprived phase of the puppy phase. We've gone through the challenging adolescent years. So now we're into adulthood,
Yeah.
uh, which is, reaching adulthood is somewhere between 2 and 3 years of age.
Mhm.
And I think my point earlier is some dogs it is closer to that 3 years. Like, and I do find sometimes like that phase between 2 and 3 years can be, like some dogs just take longer to fully mature. So if your dog is taking a little bit longer than 2 years, that's okay. But sort of in between that 2 to 3 year mark. Uh, so yeah, so in terms of, what's going on and, I guess in terms of their brain or where they're at in their life. So before we talk about the common mistakes and missteps, what are some things that we should keep in mind?
Yeah. Well, so I think, yeah, that kind of early adulthood phase of reaching social maturity, sort of. So like you're not an adolescent, you're an adult, but you're still sort of phasing into social maturity is typically that between like 2 and 3 years of age. Um, and that, you know, has a lot to do, I think, with again, sort of harkening back to like social flexibility or social tolerance with other dogs can sort of normalize during the end of that phase. Not to say it will never change or continue to evolve, but I think that's one. And again, sort of that like firming up of what are my behavior strategies for the world, how do I view the world and the people in it? What sort of conflict resolution strategies do I choose? Those all become relatively stable in terms of the dog's development being at a point where like they mostly know what they like, they know what they don't like, they know what works, they know what doesn't work. And also generally, again, comparative to other life stages, this is typically where we can say that like um, impulse control, for a lack of a better term, but like emotional regulation abilities typically peak, and impulsivity is typically going to be lower compared to other life stages, like compared to puppyhood and adolescence.
Yeah. Cool. So yeah, so in terms of like common mistakes and missteps here, it's a little bit different because at this point I think people kind of know who their dog is, and if they were going to seek help for something, they usually have. And so like I think we tend to see, unless a dog has been adopted, if someone's had a dog for a long time, we see fewer dogs come in sort of in that adult range. I think
Mhm.
for specific behavior and training goals, we still get them, but it does decrease. Um, and I think, but the one of the things to sort of keep in mind is, and I think you mentioned this, Sarah, when we were talking about this episode, and it was like they were never a blank slate to begin with, and they're really not now.
Yeah.
So, because they've learned how to navigate the world. If they feel like they need to communicate how not to do things with a person or a dog, they kind of figure those out, or how to avoid, or again, those conflict resolution styles are going to be, probably more stable. But with that being said, it kind of leads us to our next point, which is, I think the big thing here is, when a lot of times when we get these old, like these dogs in adulthood come in, is a lot of times it's because there's like a sudden change in behavior.
Mhm.
Um, and when there's a sudden change in behavior at this age, my antennas definitely go up to kind of look at like what's going on, because it's not super common to see a big sudden change in behavior. It doesn't mean behavior can't change, because behavior can
Mhm.
always change, but like a big sudden change. And I think the big point here is, if there wasn't a big environmental change, because sometimes you'll see it if someone moves from a rural environment to an urban
Absolutely.
environment. You'll see it sometimes when they move from an urban environment to a rural environment. Sometimes that's actually harder for some dogs, if they
Mhm.
grew up in a city environment, and where they're used to seeing 20, 50 people at a time. Now they're only seeing one person on every third walk at 50 feet away, and that's stressful for them. So we do that. So sometimes like the environmental change, and that can make sense. If there's some sort of new trauma, like ones I
Mhm.
can think of off the top of my head would be like fireworks, or like July 4th, or some sort of trauma that happened,
Mhm.
that can explain it. But if there's an environment, if there hasn't been like sort of like an environmental change or something traumatic, and it hasn't been a gradual build, almost certainly the first thing we're going to point them to is to actually talk to their veterinarian, because like there's just so many times here where there's something medical going on.
Mhm.
And it doesn't even have to be something catastrophic. It doesn't mean, so, I guess for people listening, like things that we've seen over the years, like Lyme disease, right, can cause like an increase, like a sudden increase in aggression if they've had Lyme disease and had it for a while.
Mhm.
We had another dog, it was Rocky Mountain Spotted Fever. We've had dogs where they would run around, go to the dog park, look normal, and their gait was just slightly off. And so they did an MRI, and it's like a pretty badly torn ACL. So they were in like a lot of pain,
Mhm.
although they weren't really displaying it, because a lot of dogs can be pretty stoic about that stuff. Um,
Yeah, stuff like a cracked tooth or an ear infection that they're not like obviously messing with, but it's affecting their well-being. I think the options are endless, and I think that's a very well-made point, is that yes, we often see, if you can't point to like there was a notable environment change or a notable change in social like relationship dynamics within
yeah,
the home, or some, sort of traumatic or significantly negative experience, then yes, the first stop is generally going to be your veterinarian.
yes,
Um, Especially
yeah,
at any age, really, but especially at this age.
yeah, especially at this age, I think.
Yeah.
And the other part about that too is sometimes, and I think Dr. Levine talks about this, I think in our nature driven nurture course, about the exams. And sometimes like your dog goes in for these exams, and you're asking for this, and because they're a little aroused and a little excited, and maybe some dogs even like to go to the vet, or they're a little nervous, like they're not going to act like their normal selves. And so it's important for you, I think. What's so nice now is you can take video. So if you have
Mhm.
video of things that might be, that you may have noticed, that like, hey, I'm a little concerned about this. Again, sometimes you might not see anything, so you're going to have to completely rely on the vet at that point. um, but definitely like take video of stuff, before you go in, I think can always be helpful.
Mhm.
And then the other thing too is sometimes, like, I think on the more frustrating side sometimes is, having done this for a long time and have seen how much of an impact it can make, is like sort of that, you know, just sort of like that chronic low level pain. And I guess, I
Mhm.
mean, we don't know if it's low level. I mean, for some dogs, it might be high level, but I suspect for a lot of dogs, it's kind of like chronic low level pain. And it just sort of makes them like uncomfortable and a little grouchy or a little
Mhm.
anxious. And it can be sometimes hard for that to come out in a vet exam. So I think, again, you have to rely on your vet, because that's who needs to diagnose these things. But I do feel like it is important, where like if your spidey senses are tingling, and something's going on, like there's nothing ever wrong about reaching out about a second opinion, or seeing a specialist. Like if you're kind of if your dog is maybe getting a little wobbly and you're like, hey, they might be a little in pain, you might be able to ask your vet for like an orthopedic referral if you have that around, or even just like getting a second opinion sometimes and just say, hey, like so it might not be anything. Obviously the vet's not trying to miss anything, but I do know sometimes that does get missed. Or on the other side is sometimes we can see certain things with a dog where it's pretty evident to us that they are in some pain, and I think sometimes it's hard to get some people to take that seriously, and it can be a little frustrating because a lot of times it can just be like some sort of anti-inflammatory, or something that the vet will end up prescribing. Again, please don't go into your vet and say Brian said to prescribe an anti-inflammatory, but like sometimes we can see stuff that is just so easy and very inexpensive that can make a huge difference in terms of like the dog's welfare.
Yeah, no, absolutely. And I think we'll probably talk about that a little bit more in the seniorhood phase as well, because I think that can become super relevant there. But I think it's valid in adulthood. And I think, again, knowing that like, sort of the flip side of that, I think as well, or not really the flip side, I guess, same on that same level is sometimes with adulthood, there can be, pretty drastic drop offs in interest level in play or energy level or desire to take walks that sometimes I think people can chalk up to like, oh, he's just getting older. But really, if your dog is 4 or 5 years old, apart from potentially being like a really giant breed, you're typically not going to see that steep of a decline in interest level or energy level. And that can absolutely point to some pain or physical discomfort. But I think sometimes one of the things in adulthood that we can absolutely see is like people might just assume their dog is sort of settling down from getting older. And that absolutely happens. But the degree to which sometimes it's happening can indicate, oof, like you shouldn't have slowed down that much this quickly. So let's go to the vet and see what might be going on, because chances are you might be uncomfortable in some way, shape, or form.
Yeah, absolutely.
Yeah.
Yeah. And I like on the pain thing too, like to your point, we're going to talk about it in the senior dogs, but just also like those dogs, like sort of like 5+, like some dogs do just seem to
Totally.
age more quickly than other dogs. And some of that stuff where even though they might not be going gray around the eyes yet, like they could be getting a little bit more rickety, some dogs just do. So it's, always something, to keep an eye on.
Yeah.
But yeah, I think that's sort of the big thing there is sudden behavior changes. If you don't have an idea like what it is or what you need to do, then that's definitely a really good time to reach out for some additional help, because you probably need someone with a breadth of knowledge to help you navigate that. And it almost certainly is going to involve veterinary input as well.
Yeah, for sure. And then I think the last thing about adulthood, just sort of quickly, is because this is generally a time of relatively stable behavior. And because oftentimes, again, unless it's like a dog that you adopted when they were older, people sort of feel like they've gotten through the teaching stage, right? Or the learning, like you did your puppy class, you did sort of some additional follow-up lessons to get you through teenagehood, and you sort of feel like, okay, like they know what to do, we know what to do, behavior's pretty stable. I feel like sometimes one of the other pitfalls that we can run into with adulthood is that we just sort of get a little too comfortable and take for granted that level of responsiveness that we've achieved, and also that relationship piece that you probably worked so hard to build over like the years that preceded. So I think, in adulthood, just a reminder sort of to avoid one of those common mistakes of just kind of slacking off of, that's a terrible way to put it, but we do.
But taking it for granted,
but taking
right?
for granted the responsiveness, and sort of saying like, well, I don't really take treats out when we go off leash anymore, or I don't really do. And a lot of times that behavior will hold up for a while, but it just kind of gradually declines, and some of the relationship benefits of that kind of can gradually sneakily decline as well. So I think, just kind of being mindful of like, continue to show gratitude and appreciation for responsiveness and good choices, and and good behaviors, and continue to sort of foster that relationship and reward behaviors you like all through adulthood, even though they already know what to do.
Yes.
Yeah. I think that's
Absolutely.
the other one.
And I'll also put a link to the episode that we did. I think it's one of our most popular ones, like the overlap between medical issues and behavior with Dr. Pockle.
Mm-hmm.
I'll put that in our notes too. So just in case you have an adult dog or the senior dogs like we're about to talk about now, and you have more interest in how medical stuff can show up in behavior and have an overlap, that's a amazing episode with an amazing veterinary behaviorist. And if this area is new to you, I highly recommend listening to that.
Absolutely.
All right, the golden years.
Yeah.
Honestly, probably it's senior years are definitely towards the end it gets really hard. It doesn't matter how many dogs you have, but kind of those early senior years, like, I don't know, they're some of my favorites, to be honest. Because like they're just they are who they are. And your usually relationships are really deep. Like, it's just, there's like the routine and the comfort that the routine brings to both of you and all of those things. So but yeah, what are some things that are going on in
the background?
In the brain? Yeah.
Yeah, in the background. So yeah, it's just part of aging. I mean, super similar to people or any kind of animal who's reaching that sort of senior later part of life stage is, we are going to see age-related changes in neurology and sort of in brain function that can lead to, impaired cognitive abilities sometimes. Again, just as a natural part of aging that happens. I think also what we can see is like a decreased ability to cope with stress sometimes and having a harder time adapting to changes in routines. So really, a lot of older dogs will really thrive on sort of predictability and predictable schedules. And then, there's going to be changes in body and physiology too. Like, we're more likely to see achy bones and fuzzy vision and impaired hearing, and the stuff that can come along with that in terms of changes in, social interaction preferences or physical activity preferences, or, I know I'm jumping into, but like hesitancy about navigating certain situations or surfaces that weren't there before. So those are some of the developmental things that are happening as our dogs move into seniorhood.
Yeah. And so what are some of the common mistakes that you see in this
Yeah.
stage?
There's a few, and I think not at all intended. I think sometimes like our dogs become seniors, like it sneaks up on us. Like one of our little dogs, Joey, he'll be 8 this year. And in my brain, he is absolutely still a year and a half.
100%.
So I think it just happens. It goes by so quickly, and they're, especially if you had them since they were younger, like they still just seem like little puppies, even though we've had them for their whole lives. So I think one of the most common ones is sort of jumping to or mistaking age-related behavior changes to disobedience. And not purposefully, right? We just assume, they're not being as responsive to their cues. They don't sit when I ask them to, right? Or they're like much slower to turn around and come when called, or they're having accidents in the house. And it could be that you've, per adulthood, just sort of gotten a little lax with training and reinforcing, but there's also a really strong likelihood that there might be some life stage related things happening that are contributing to those behaviors, right? Whether it's like decreased hearing or some physical discomfort where sitting is just uncomfortable, right? Like it hurts when I sit.
Yeah.
So I'm slower to do it, or I'm less likely to respond the first time. Or, my bladder's not as strong as it used to be. And I have to go to the bathroom more often. I just can't hold it as long as I did. So I think those things to sort of keep in mind that, again, if you're seeing a change, and this can be gradual over the span of, 6, 8, 12 months, or it can be fairly sudden. Again, fairly sudden, immediate stop the vet. For the more gradual ones, your first stop may also be the vet, but they can be harder to, we don't notice them as much as they happen gradually. But I think that's a big one that we see. And then I think the other one, and this is, we talked initially with puppies, is that we are all pretty comfortable with the idea that when we have a puppy, we have to do some level of like puppy proofing the environment to make it comfortable and safe for them. And for some reason, we haven't, it hasn't become commonplace to do the same thing for our senior dogs, but it's just as important,
Yeah.
to sort of
100%.
optimize and adjust the environment for their comfort and safety. And we can talk about specific ways to do that, but I think that's a big one that we just don't see as commonplace, and little adjustments can make a huge difference in their overall just happiness and comfort level in these later stages of their life.
Yeah. Yeah, definitely. Like, and I think, we think back, it's easy to think about Buster, who was our senior dog, who passed away. It always feels like yesterday, but I think it's quite a few years ago now. But
3.
yeah,
Yeah.
But like for him, like traction, like the mats that we put down, because again, he was pretty wobbly there by the end. And again, like he was still enjoying life and everything, but he just didn't, he just balanced what wasn't great. And so for him having that extra traction, like we had like little yoga mats put out in like areas where he would like frequently walk, and that made a massive difference for him. And then also like adding even just like just like you would have a toddler, like we added like padding around like some tables or like pointy edges and those types of things, so sometimes he would fall over, so just to make sure he wasn't hopefully had a little bit more cushion if he was going to bang into something. And I know it's a little sad to think about, but it is really important to do those things. And
that traction piece as well, I know we're talking about like seniorhood, but that's totally a valid, easy, often needed one really early in senior years. Like if you're just even a little bit uncomfortable having traction, so like your whole house is hardwood floors, like throw down some carpet runners, you know. And it's just such an easy way to make their daily experience a whole lot more comfortable. That's just a really common one, I think, that we run into. But also things like, you can see like, well, whether or not they're still willing to like jump up into your vehicle and out of your vehicle, that might be extra hard on them at this stage. So maybe you move to getting them a ramp or having them like picking them up and sort of being proactive about that. Same thing with like on and off the furniture. Try to set aside whether or not they're still willing to do it. Some you will outright see they're way more hesitant or slower to do it, or they're like, they just won't. But some dogs will absolutely still do it, but that doesn't mean it's not causing them discomfort or that it might be detrimental to their health and overall well-being. So I think being mindful about any sort of like obstacle traction stuff for sure. I think also there's like a lot of dogs who get a little older and like, just like with people, comfort is at a premium. So looking at bedding and dogs who may before never have really sought out super cozy places that may really appreciate an orthopedic bed and some really comfy blankets and stuff like that. Sometimes swapping out types of chews so that, senior teeth are a little more fragile, or if you had enrichment toys that you were giving them that were like super complicated and required a lot of manipulation, that may actually become uncomfortable for them at a certain point. So switching up to sort of some easier ones that are a little bit, require a little bit less kind of physical manipulation to navigate, I think are sort of things to keep in mind there.
Yeah, absolutely. And I just want to add on like the thing you said, like, because I about, for example, jumping up in the car is like, you will notice differences. Like, so it's like they don't go from, generally they don't go from being able to jump in the car and then not. It just like it gets harder. And so you're going to notice that. And this is something too, I feel like I had to teach myself, is anytime I say like, oh, they're fine, like you have to think about saying fine in quotation marks, because like there's probably something going on there, or something else that we can do.
And usually, well, if we think about all the contexts in which we describe ourselves as fine, I think we can apply it the same way to dogs.
Yeah. And then, and the other thing too, I think the other nice thing too, if you do have to pick up your dog, I always remember, with Buster, I don't know how you lifted Mo at his 95 pounds or whatever he is now.
I
sometimes,
don't think I could now.
But like, just like making, even like there's stuff you can do to make that predictable. Cause I remember we would always do like 1, 2, 3, lift, and lift them up. And like he would like come over and get ready to go up. And when you say like the lift, you could see like his little feet stretch out, like, you know, he was popping up. So
Yeah.
just to make it like a little bit more predictable. So
Mhm.
like, so sometimes like just adding in like some sort of like little cue or predictability into that. If you're adding in new things like that, it's a nice way to sort of introduce something new
Yeah.
that they feel like they still have a little bit of like that they understand, and makes it predictable.
Yeah.
Um,
For sure.
and then the other thing too, I think is there is, you know, you will see sometimes anxiety start to increase as dogs age too, and whether that's like pain related. We talked about that because sometimes, you know, pain can absolutely increase anxiety.
Mhm.
Um, and the other thing too is, you know, if you speak to your vet, or, you know, it's a veterinary behaviorist, but like there are medication for, you know, some of those cognitive declines that start to happen. Same things that happen in people. So
Yeah.
there
And
are,
if you ask your veterinarian, there's actually some really solid assessment tools for canine cognitive dysfunction in terms of like diagnosing and figuring out sort of where they may fall on whether that's an emerging issue or an issue that's already present. So like that's something that there's some really solid assessment tools for that, and you know some varying treatment options there. So
yeah. And it's definitely, I mean, we've seen it with our own dog and other dogs. Like sometimes that really adds a significant quality of life boost for months or sometimes years
yeah,
that we've seen. Like, I mean, like there have been some dogs where like they were really struggling, and then that really just it was like it's almost like you rewound the clock by 2 years. At least
yeah.
some of the times that I've seen it. Again, that's not going to happen for every dog, so I don't want to get false hope that that's always going to happen. But I do want to let people know like that does happen for some dogs, and being open to that, I think, is really important.
Absolutely.
Yeah,
Very much agree.
yeah,
Um, yeah, and then I think we did a pretty good job discussing it in the adulthood phase anyway. But I do think, yes, with the senior years piece, we very often overlook sort of chronic low level pain that just think about humans in their senior years. Like there's a lot of achy bones and discomfort and potential arthritis depending on the individual, and just, you know, there is more physical discomfort at this stage of life, and we don't do a great job of recognizing and treating chronic pain in dogs for a variety of
hmm
reasons that Brian mentioned. And if any of you do end up taking the nature driven nurture course that's available in the online school, there is a really wonderful module in there about sort of recognizing pain in dogs, and the difficulty recognizing pain in dogs, and all that kind of stuff by Dr. Emily Levine, one of our board certified vet behaviorists. Um, so yeah, I think that's another one just in senior years, that like your dog may not be limping or, you know, showing sort of what we think of as the obvious signs of acute chronic pain or like acute pain, but that doesn't mean they're not experiencing daily chronic pain that's impacting their, you know, quality of life.
yeah, absolutely. And I think just to add to that, like the nice thing about that is, again, like, you know, there are things like anti-inflammatories and kind of like regular stuff that's that can be used. But, you know, when you speak to your vet, like, because there's other things too. There's, you know, acupuncture, and there's like the water therapy, and there's some pretty cool stuff out there. And I know our dog Buster did acupuncture for a little while, and he always seemed to really enjoy it. And again, I don't know if it
Well,
made a huge
the veterinarian who did it always laughed at him and told him he wasn't taking it seriously because he was seemed like he was just enjoying being close to
strange.
a new person, which is, you know, was Buster through and through. So I don't know if he just enjoyed the visit with a stranger for an hour at a time, or if the acupuncture helped, but
Yeah.
nonetheless,
Yes, but there are other clients that we've had where they do feel like it
absolutely,
helps. So I think the nice thing is just planting the seed that there are actually some cool different options out there, and there's some like newer things that, you know, depending on what your vet recommends. That, um, again, if it's in your budget and it's in your area, then there are some other things that you might be able to try as well that they're kind of fun and beneficial.
yeah.
So great. Well, I think we covered it.
Whew.
I know. But yeah, but I think this was great. And then, yeah, this is, and this will sort of lead into our next episodes as we talk through sort of the biological factors of our dog's nature. I know we did a little bit of nurture stuff today as well, but we'll have some more episodes coming, some different guests coming. So pay attention for that. And anything else you want to add?
No, this was great.
All right. See ya.
Bye.